go.
Good day. This is Brian Castle, MD, MPA, and my friend Poppy. Yes, he's saying hi. And as you know, I'm a physician and physician executive for close to 50 years. And we have been talking about Healthcare 2020. This is the 5th vlog in the series, and with this vlog we will end part 1. And specifically, we're addressing the fact that not having health care and not having health care coverage can kill you. So we're calling this one, This Can Kill You. I'll move out of the way. No, Poppy, not yet. We're going to talk a bit. In part 1, we have been discussing the impact of health care coverage, or the lack of it. I was just retiring for the second or third time. Yes, I know, Poppy, hi. When a congressman, whose name and state will remain hidden, Idaho, flush with victory after the House of Representatives passed that health care reform in 2016, he went back and appeared before his local town hall. Much to his surprise, one of his constituents confronted him with the comment, "You have just voted to take away my health care. You want us all to die." His reply, "No one wants you to die. Besides, no one ever died from lack of health care." Well, that sounds rather quixotic, and much to his surprise, his town hall agreed. They acted rather negatively, and I had to come off the sidelines again, and I started researching the subject. Now, I make it my current focus to talk about healthcare, not in hyperbole or promoting unsubstantiated data, although I do have an opinion. My approach to Healthcare 20 has been to research the facts using the logic of evidence-based medicine. I have presented the facts and will continue to do so based on research, and it is up to you to do your homework and determine which data is relevant to you as you face the difficult task ahead of deciding the future of Healthcare 2020. Having said that, let's go to the next slide. Let's talk about return on investment. That's what ROI means. And how much, ROI is really how much bang do you get for your buck? And in the current American healthcare system in transition, not much. Unlike the traditional return on investment models, in healthcare, benefits are frequently gained from cost avoidance rather than from revenue-enhancing activities. So I guess you might say it's all about the cost. Well, is it? There are other parameters we must consider. Access, that's getting to the health care, the quality of care, make sure they don't do any harm, and what we've talked about before, the social determinants of health care. So just keep this relationship in mind as we move forward. Cost, access, quality, and the determinants, the social determinants of health care. That said, let's talk about the healthcare benefit circle. We've talked about this before. This is where healthcare coverage actually is, but there are a whole bunch of things that have got to happen, and if they don't happen, it results in money out of your pocket. So, access is being able to reach a place where the healthcare is provided, and that access is driven by cost. So at the end of the day, cost is that money out of your pocket. Premiums, deductibles, network requirements, benefit coverage, medical necessity, co-pays, co-insurance. We've talked about all of those before. And the bottom line is, we could be left with financial stress. Now, what is financial stress? 9% of Americans, approaching 30 million or more, are uninsured. But then there are another 31 million Americans who are underinsured due to this financial stress. And the question is, Why? Here we are. Insured, not underinsured, underinsured, and uninsured during the year. And you can see how many went without health care. 31%, 53% in the underinsured, 31% in the insured, not underinsured, and 68% in the uninsured. And what was the result? An outstanding medical bill. And how impactful was that? Even with the insured, 21% had an impactful medical bill. The underinsured, 45%, and the uninsured, 51%. So the bottom line is that financial stress is a big factor in what is going on in today's healthcare situation. Now let's talk about the current healthcare debate. Uninsured and underinsured, that financial stress associated with that, results in not having health care. And remember, this part is all about not having health care or access to health care. So let's look at the health care reform process that, as I've mentioned before, is deficit reduction. And here we can see the impact, and this is up through 2018. Here are the number of insured people per million with the ACA in place. If the ACA were repealed, we would lose 19.7% of you would lose your coverage. If there's tax deductions removed, 15.6% would lose your health care coverage. If we go to Medicaid block grants, 25% would lose coverage. And if we go to these short-term pseudo plans, as I like to call them, for sales across state line, another 17.5% could lose their health care. So while we talk about the health care debate, it is really deficit reduction. And the results of that debate could be quite devastating on those of you who have health care coverage. Now, financial stress leads to uninsured and underinsured. And here, if we look at 2010, and this is the folks who have health care in the categories of uninsured, underinsured, and the two of those together. Prior to the ACA, 80 million folks were either uninsured or underinsured. With the advent of the ACA, those numbers began to fall, and that reduction was primarily in those who were uninsured becoming insured. And you can see that the total came down. And then in 2016, it continued to come down. Again, pretty much driven by the uninsured getting coverage. But look, something happened in 2017. We see the number of uninsured go up. We see the number of underinsured go up, and the total goes up. And in 2018, the uninsured number went up. And we don't really have data yet on this other factor, but it's not trending in the way we want it to go. So let's talk about mortality in the United States. Because at the end of the day, what I want to link is being uninsured and underinsured with dying. In other words, you can lose your life if you don't have health care coverage. So these data come from the National Vital Statistics System, and with the most recent data that we have, life expectancy declined for the U.S. population to 78.6 years in 2017, the first decline in quite a while. Age-adjusted death rate increased by 0.4%, and age-specific death rates increased for age groups 25 to 34, 35 to 44. These are the two groups hit hardest with underinsurance and uninsured. an 85 and over group was involved as well. But the death rate decreased for the group 45 to 54. So this is the data on mortality, keeping in mind the increase in the uninsured and the underinsured as we move from 2016 through 2018. So at the end of the day, this is what we have. In 2017, there was a lot of data from the Institute of Medicine's conclusion that health insurance saved lives. And this data indicated that dying among the insured relative to the underinsured happened at anywhere from 29% to 3% less often. So, if you're underinsured or have no insurance, and we use that 3%, which was the lowest in this data, and then if we went to 6%, these two lines will indicate those folks where the lack of health care coverage could kill you. So let's look at this. Here's the population. These are the diseases, the top ones: heart disease, cancer, chronic lower respiratory, stroke, other internal causes, suicide. This column are the uninsured, Medicaid, employed. These are the underinsured, exchange-based. And here's the mental illness if you're depressed. And if we took this 3 to 6% to the data that indicates how frequent one dies of heart disease, cancer, chronic lower respiratory disease, stroke, other internal causes, and suicide, then we can get some real numbers of the potential for lack of health care coverage killing you. For example, here are the number of deaths in each of these categories for the Medicaid population. Here are the number of deaths in each of these categories from the employed population. Here are the number of deaths in each of these categories from the exchange-based, and here are the number of deaths in those who are mentally ill, primarily depressed, from suicide. So here are the total that you would expect with this group of diseases. And if we added 3% more, here are the numbers that could die just from these groups of diseases because they don't have health care. If we go to 6%, the number gets greater. And what if we went up to 29%? That number would be pretty astronomical. So at the end of the day, I would suggest to you that lack of health care coverage can kill you. To how many folks? Anywhere from 30,000 to 100,000 additional deaths per year because there was no health care coverage. So, what have we talked about? Let me try to summarize. The bottom line is that this can kill you. In the current American healthcare system in transition, unlike traditional return on investment models in healthcare, benefits are frequently gained from cost avoidance rather than from revenue-enhancing activities. And in this case, cost avoidance, as we've seen, leads to lack of access in the underinsured or no access in the uninsured. Healthcare reform to this point has been about deficit reduction, not really improving the access to healthcare. And, depending upon the circumstances, folks, 3% up to 29% greater risk of dying if you are uninsured, no health care coverage, or underinsured, you don't access health care because of cost. And that could lead to anywhere from 30 to 100,000 additional deaths per year just because you don't have the proper access to health care coverage. That said, now the commercial. Thank you for joining me today to discuss the future of healthcare. I am Brian Castle, MD, MPA, and I have been in healthcare for almost 50 years. I sort of feel like the insurance company, the one that says, We know a thing or two because we've seen a thing or two. Now, if you like what you see, go to my website, www.americanhealthcareintransition.com, all one word, all lowercase. Subscribe so that you will automatically get these vlogs and other data about healthcare so that you can see what is important for you and make your decisions based on facts. Talk to you again soon. Bye-bye.